Hi. The problem that I'm focusing on is to get an idea about how COVID got transmitted among the children. The dataset that I'm using is basically notification dataset and the testing dataset. The graph that you see here showcases per week what were the number of cases tested positive for each of the countries. You will see in subsequent slides like if there is any hidden insight out of it. This graph is basically a subset of first one. We have just taken the data of the children, basically the folks who are less than 15 years of age. The right side showcases this surge part, like the part which has the which have for which we have seen the significant increase in the number of cases. Now to compare the data set, like the number of overall cases to the number of children getting tested positive, we will take example of Italy. Now we can say that you can see clearly that both graphs are structurally similar. So they are basically a scaled version of each other because the value is quite large for overall cases, which it will be, and it is somewhat lower for the specific for children. Now, in order to numerically annotate like what exactly or how what percentage or what amount we can say was the total number of children which got impacted throughout the weeks for which we have the data, we can do it in this way that we can prepare a table with overall cases, the children cases, and then we can figure out the ratio of how many children were there for a specific overall cases. And on an average we can see there that for on an average that every day 1/12 of all the positive cases in Italy were actually the children who were less than 15 years of age. So this is a good insight like from the data set that we got. The subsequent plan is to extend it further to figure out like what all government policies help to minimize or how impactful they were in minimizing this spread among the children. We can also do the same exercise for the elderly people and see like how it got impacted for how COVID got transmitted among the elderly people, and we can infer more from the data set that we have got. So the in the subsequent sessions I'll plan to get a deeper insight or get more insights into this study about how COVID got transmitted among the children. Thank you.
Identifying government crisis response to COVID-19 can prove to be beneficial and help us understand the effectiveness and impact of these measures on keeping this virus at bay. We studied a few third world countries using the ACAP's COVID-19 government measures dataset. The majority of these measures are made aware by the government directly, followed by media and social media. These measures include healthcare improvement, restrictions on movements, etc. It is worth noticing that lockdown is not the most favorite measure in these countries because their economy heavily relies on daily productivity spread. Nigeria and Ghana did well in controlling the surge once they started implementing health measures. Kenya and Afghanistan have shown decent fight against COVID, but once again, public health strengthening and economic measures helped their cause. Nepal and South Africa brought down their COVID cases massively with similar measures, and most interestingly, the heavy use of media and social media. Similar trend can be seen for Uganda, who have done well considering they have more than twice the population of Guatemala. Tanzania have declared themselves COVID-free since June 2020 and have also rejected the COVID vaccine. With a population of 58 million, that is impressive. And once again, they have made heavy use of social media to spread awareness. So we can observe from this data how using the right measures with awareness spread through multiple mediums can better aid the COVID-19 control in these third world countries.
Everyone, this is Anisha Bhattacharya and I'm from the team Abraca-data. I was looking into the question that was a vaccination drive across the globe. Other countries leading the vaccination drive are Israel, United Arab Emirates, UK and USA. As the we can see that the countries with a higher GDP, more financial strength are leading the vaccination drive, whereas countries which do not have the same financial strength are not taking part actively in the vaccination drive. So, the vaccination is being manufactured by four main manufacturers: BioNTech, Sinovac, Moderna, and Oxford. We can see the major vaccines that are given out is by BioNTech, and secondly by Moderna. So the vaccination trend in the first 10 days was overall on an increasing trend. However, there were some stagnant regions in the graph, as you can see, because there were not many many countries that were actively participating in the drive and that time. It started off in 13 January 2020, and this is the statistics for the first 10 days. In the last 10 days, however, the graph has increased, showing a better trend. It's overall an increasing graph yet again, and many countries are now actively participating. However, one concerning fact is that some of the vaccines, especially the one by BioNTech, requires multiple doses for a person to be completely immune to COVID-19 vaccine. However, the thing that is happening is that not many people are completing the entire vaccination dose. They are dropping off after dose. It's one dose. So the future prospects after this EDA is that we would try to develop a time series model to predict the time required for the vaccination drive to complete. Also correlate between vaccination and number of cases as to realize how much the vaccination has been effective on the new strains of COVID vaccine that are being found across the world, and also investigate the reason for disparity by checking with other databases, like why people are not completing their full vaccination and dosage and dropping off midway. Thank you.